Welcome to our show, Coffee with Chris. Our mission is to provide you with home care tips, education, and resources to ensure you receive the quality care you deserve in the comfort of your home.
Hey everyone, this is Chris from Affinity Senior Care. I wanted to follow up with you regarding care in your home when you are about to come home from the hospital. This is a process, and that a lot of family members really they don't set it up until the last minute. So what I've seen from my experience being in home care with our family, skilled care since 2006, started our caregiving company in 2012. What I've noticed, the biggest thing is that family members do not plan ahead. So there's usually a frantic mode of when they have to set up home care services, and it's usually a couple days before they're about to leave, and they talk to the discharge planner, and the discharge planner tells them that if they need home care services, we need to set that up, and so we could recommend someone for you, or possibly another company that you would like to have. So the options usually typically go where you can select the right home care company, or they can select the home care company. Now, there's pros and cons to that because you're not sure where the home care company is coming from. If you always want to look at local companies, because a lot of the staff are going to be local. So that's something that you want to ask when you talk to the discharge planner. Where is the company? And you might want to call them too and talk to them and see where their location is. And that helps with many different levels of the care professional showing up on time. The territory matters too, because if they were to, one of their care professionals have to reschedule, do they have somebody to replace them too, as well too? The insurance company sometimes can dictate what type of home care you have too. It doesn't matter even if you choose the right home care. If you are, make sure that they accept your insurance. So setting up home health care can be covered by insurance. So Medicare services covers skilled home health care. Now let's put that in one category. All right. Now, there's another category of type of home care that many family members think it's the same, but it's really not. It's caregiver services, but we also call it in the healthcare world private duty. All right. So home healthcare services can be covered by Medicare with a physician writing a script. The physician that's at the hospital at that point in time can write the script for your parents to get an RN, a physical therapist, occupational therapist, a speech therapist, a medical social worker, also a home health aide. So all these disciplines usually typically come in within 24 to 48 hours after the hospital sends over the script over to the agency. So if you have a relationship with another company or you chose the one that you want, you have to give the discharge planner or the case manager, wherever you're at, a facility or a hospital, the fax number, the company name, and the contact, and make sure that they fax it over to the right company. All right. So that way the nurses and the therapists can start their evaluation right when you get home. Usually, typically, it's 24 to 48 hours when there's going to be the first visit of any type of discipline. And each one will come in and they'll do an assessment. And during that assessment time, they're going around the house and making sure they set up anything for safety purposes. And they also will create a schedule with you and tell you how often they're going to be coming. Now, they always want to reach their goals, but there's no guarantee of how often they will come and until they come out and do an assessment. Every person is going to be different, so they can't just come out and just put a number and say how often they can. A lot of family members want continuous care, but there are insurance guidelines that we have to go by, and there also too is there's certain type of care diagnoses that we're only certain visits are allowed to. The doctor and also the nurses and the therapists are the ones that usually make those decisions. Okay, so usually what the family members want is not always what you can get. So Medicare does cover those services, and if they feel like that any type of condition has changed or they come in for a different reason, you can always have Medicare services again. A lot of family members don't know that. So once your home health care services are finished and you still want that nurse, but they're coming in for the diabetes, but then they developed a wound on their foot, then that's a whole nother episode, another type of scenario where the physician can write a script for. So it's always good to see like what were the goals that we came in initially, and then they can be able to get recertified for that type of condition. So, and even for physical therapy and occupational therapy, if they're going in for a hip replacement and it was on the right side, and then they wanted care for a month later down from the left side, you could still have home health care. And over here, if you had your therapy with us, that you're going to get the same staff member that did the right leg or the right knee or the right shoulder, whatever type of surgery it is, or the nurse that came out and treated, if you request the same staff member, you're going to get the same staff member. We don't have much turnover rate over here. Now, there's other insurances that do accept home health care. So it's always just good to call the company and make sure that they accept your insurance and do an insurance verification. Right. So from hospital to home, also too, is you want to make sure that you have the right assisted devices. So having a home assessment, especially when you contact me, I'm going to come out to the home. I'm going to give you every recommendation possible to make sure that your parents have a good environment, and also for our nurses and therapists and caregivers to be out there. This is essential. So these are things that you want to make sure you set up. You don't want to do when your mom and dad are at home. Okay, it could be stressful during those times. It already is stressful at what you're going through now. So it just makes your life a little bit easier, so that way we can get the home set up. And so that goes with Hoyer lifts, walkers, wheelchairs, commodes, urinals, hospital beds, grab bars, shower chairs, etc. And so these are recommendations that I walk around the house, and I will tell you what you should and shouldn't get. And this will help you save time. Now, next is with private duty. If you want private duty services, you don't have to tell the hospital that you need a script from a physician, but you do want to let them know that you do want a caregiver there to help your for example, for physical therapy, the therapist is out there, they're doing exercises, but they're only there for 2 weeks. Now, the goal of the therapist is to train the caregiver. So it's really beneficial to have a caregiver there if your parents are getting nursing or therapy, because they're going to train the caregiver to do what needs to be done when they're not there. Nurses and therapists visits are typically an hour. The caregiver minimally is there for 4 hours or more. And so they're going to be able to do majority of the exercises the times that when the home health care is not in. So that's very beneficial. And the long-term care insurance is another topic that we can discuss. I'm going to have a separate video on that too, and many educational videos on that. But if you have long-term care insurance, what you need to do is you have to have me come out and do an assessment and figure out what the daily activities and what type of health status is your parents. And then we have to send that over to the insurance company, because they need to have a necessity of the reason why you need care. That comes from a home care company. So long-term care insurance usually has a day rate that they reimburse. It could be $150, $200, whatever it is that costs per day, because we charge at a billable hourly rate. So that $200, you obviously will be utilizing that based on the hourly rate of the caregiver, what will be covered. So that helps out tremendously. And what they'll also do is long-term care insurance company will send a nurse out too, just to verify that you actually need the care. I coach a lot of family members during this process to make sure that the questions that they will ask and what type of if your parents are eligible to receive long-term care insurance. But they always say the statistic for a lot of family members is 1 out of 10 family members actually know how to use long-term care insurance and when to use it. Average individual uses their long-term care insurance the last 2 to 3 months of their life. So they've been paying a premium for about 20 years or so, and then they use it for the last couple months of their life. And that's not really, it doesn't have to happen that way. You could start gradually slow and use your policy. So there's also workman's comp, there's disability insurance, there's auto insurance that covers home health care too. So a lot of these questions can be answered by a simple phone call. You can contact me and we'll set it all up, and I'll make sure I come to the house before they come home from the hospital, and make sure care is set up right. 248-363-8430, phone call away, just to make sure that you have peace of mind. Take care, and we'll see you in the next video.